Good afternoon and welcome to Virtual Creation Studio here in Charlottetown, Prince Edward Island. Today we're going to be talking about health spending accounts, and it's kind of an interesting topic because more and more people are turning away from kind of traditional health plans to more designed for particular needs and particular people. So we're delighted to be here, and I want to introduce Harry Demons, who's probably the hardest worker that I've ever met in my entire life. He's going to be coming in, and introduce yourself and welcome, Harry. It's great to see you, and it's great to be part of the health spending accounts.
Thank you. So I'm Harry Demons. I work with a company called National HealthClaim, and we're probably one of the larger health spending accounts in Canada. So we're going to talk about health spending accounts, where they fit in, and how they might help you.
Yeah, so I know your daughter came into our office a number of months ago, and she works with you I think she's out of Alberta.
Yes, she is.
Yeah, she is. Great girl. And she could come up with the idea of maybe doing a little podcast to explain what health spending accounts are and how they're good for small business owners. So the question is, what are health spending accounts, and how are they good for small business owners?
That's a good question. Well, really, a health spending account is a provision through the CRA, or the Income Tax Act, that allows business owners and their employees to be reimbursed tax-free for eligible medical expenses. So the corporation gets to write off the expense as a business expense, and the employee or the person receives the benefit back tax-free.
So, in essence, if you're putting through $1,000 worth of claims, what percentage of that can you claim off your income tax?
Well, right now, if you were an employee and you said, I don't have a benefit program and my company's not paying anything for me, so you talk to your boss or your owner, and he says, well, look, I'd like to help you out, Paul. So here's what I'm going to do. I'm going to increase your salary enough to pay for that $1,000 medical expense that you got.
Okay.
So in order for him to do it, he can write salary off as a business expense as well. But in order to pay that full $1,000, he has to pay you the $1,000 plus the amount of income tax that you would pay on $1,000 income, and then all of his payroll tax on top of that.
That could be quite expensive.
So it could be quite expensive for him to pay that $1,000 expense. And in reality, it hasn't really helped you because it has put you $1,000 plus higher in income to pay income tax on.
Okay. So if you set up a health spending account, obviously it's better for the employee and for him.
Yeah, so it's a win-win. For the corporation, if they're in the position to do so, they're able to provide that benefit to you and write it off as a full business expense, and the employee gets their portion back, or the eligible expense, tax-free.
Wow. So who would qualify, and what makes a business eligible to have a health spending account?
Well, remember that it's covered under the Income Tax Act and not the Insurance Act.
Okay.
So it's a little different than an employee benefit program. So to be eligible for an HSA, the benefit has to be received by virtue of employment.
Okay.
In other words, as an individual, I can't go out and have an HSA, a health spending account, and write it off. Okay? So it has to be by virtue of employment. So it's not simply ownership. If you're active in the capacity as an employee, preferably drawing some T4 income. Now, as an owner, you might be taking a huge part of your income as dividends, but if you can take some T4 income then and set a reasonable limit for your HSA amount, then CRA looks at it as a legitimate program, and they allow you to write it off. Now, there's some great cost stability here, and a real tool for you as a small business owner, because it can be used to provide a top-up to a traditional insurance plan, or it can be a standalone benefit.
Wow.
Now, maybe you're familiar, Paul, and I'm sure you are because you do benefits.
Yeah, we have quite a few. Yeah.
Oftentimes, the insurance company has a small HSA attached to the benefit program.
Okay.
The difficulty is oftentimes the employee doesn't even know, And secondly, it's very difficult to access and to use. And so oftentimes employees go through the whole year and they never exercise that HSA portion. Now the company too sometimes doesn't realize they have an HSA attached to it. So it becomes very difficult. Now the advantage of an HSA, a health spending account, is you pay only for what you use. Now remember, a traditional benefit program, if it's through an insurance company or whatever, you pay monthly premiums.
Exactly.
Whether you've used the plan or not, you're going to pay the premiums. Yeah. So an HSA is different. It's a user pay. You pay only for the benefits that you use. So as a business owner, it gives you some real cost stability and containment because you as the business owner set the limit on the plan.
Okay.
And it doesn't have to be the same limit for everybody. As a business owner, you might take one limit. You might have managers as a different limit and the rest of the staff at another limit.
Okay. So you can kind of design it to kind of suit your individual needs, correct?
That's right. You can use it as a tool for your business to attract and retain good people.
Yeah, exactly. Now, for companies that are sole proprietorships, would it be harder for those type of companies as opposed to limited or incorporated companies?
Yeah, very easy for an incorporated company because of the Income Tax Act. As a sole proprietor, it still can be done, but you have to prove that you have at least one employee at arm's length.
Oh, okay.
Okay, so it can't be a subcontractor.
Right.
Right, and oftentimes small businesses, to get away from paying income tax and so on, they ask the employee to come on as a contract employee. So it's not the same. You have to have an actual T4 employee at arm's length, so it can't be a family member.
Okay. Well, that's good to know. Costs. Obviously, everything costs money. So what are the costs involved? And we'll get to the Atlantic Business Federation probably towards the end because I think we've made a deal for health spending accounts for Atlantic Business Federation members. So
yeah. So the normal or industry standard administration fee for health spending accounts is 10%.
Okay.
Okay. Plus any tax that's asked for by the provincial government. So every province is a little bit different. Okay. For your area, for New Brunswick, PEI, and Nova Scotia, the 10% admin fee is the only thing that attracts HST.
Okay.
So the claim itself doesn't attract HST,
but
the admin fee, the 10% does.
Does, okay.
Now, normally there's also a setup fee on HSAs, and the setup fee is usually $300.
Okay. So does this... Okay, so Atlantic Business Federation have a deal with Desjardins and Blue Cross for small business. So would this replace those type of health benefit plans?
Not necessarily. It's not designed to be a replacement, but it could be a standalone plan if it's preferable. Let me give you an example. Oftentimes for benefit programs, Paul, as you know, one of the difficulties is how many employees there are.
Yeah.
So almost all the companies have a minimum that they will go down to. Some might be as low as 5 employees, some might be 3, and some might be 1.
Okay.
But oftentimes there is a limit as to how far they will go. So some of these fall outside of a traditional plan. They can't get it. So in that case, an HSA would be a standalone plan. Or it might be the industry itself is not the industry that insurance company is trying to attract as a business. So to give you an example, one time I tried to get a benefit program for a company who was in rock blasting. Well, nobody wanted to give them a benefit program because of that industry.
Yeah.
And so a health spending account worked very well in their case.
Yeah.
So the important thing is that it doesn't necessarily have to replace a plan. It could just top up a plan that was already there. So in most plans, even if you have the richest benefit plan around, for instance, on orthodontia, it only pays 50% of the claim. So your health spending account would come in and top off and pay the other 50%.
So would it only pay out like a portion, say drugs? Could it also pay out like dental or parameds like massage therapy, chiropractor, physiotherapy, those type of things.
Yes.
So is it just drugs, or is it all?
So it's any eligible expense that normally could go through a benefit program,
Okay.
or that was eligible through CRA. So it could be paramedical, like massage therapy, any kind of therapy that is asked for by a physician. It can be dental. It could be even today, one of the big things that's coming, a lot of employees now, when they come to a company, they're expecting the basic plan, health and dental.
Yeah, exactly.
But what they're looking for is they're looking for an enhanced benefit that would cover things like mental health or fertility. These are becoming far more important to the new generation of employee. Well, oftentimes you can't put those on a traditional health plan, but you can put them in your health spending account.
What about things like fertility clinics and stuff like that? That's we've got a number of small business plans, and fertility, believe it or not, is actually the number one question that employers, especially with a lot of young staff, are asking for, because it's not covered under most plans.
Mm-hmm. Yeah.
So would that be something that would also be eligible for health spending again?
It is, and on the enhanced plan, it's automatically included.
Wow, that's very, very good. So what sets health spending account providers apart? So obviously we think the world of you, Harry. We love you, but
Gotta earn your keep.
yeah, exactly. No.
Well, here's an interesting thing about health spending accounts. There are a number of things that you should look for in a provider. So one of the first things is, because it's with CRA loves to audit.
Really?
Okay. So one thing that National HealthClaim does is that we adjudicate every claim.
Wow.
So that's not true with health spending accounts that are attached to a group benefit program, and it's not true with all HSA providers. So we ensure that every claim is CRA compliant, and we maximize the insurance that's already in place. Now, why that is important to you as a business owner is, let's say you do have a benefit program in place and a dental claim comes in. Okay, so automatically what happens sometimes with a health plan where there is an HSA, they try to use up the HSA amount before they actually go to the insured plan.
Oh,
It should be just the
I was
opposite,
going to say.
because you're paying premiums anyway for the dental benefit under your employee benefits program.
Right.
So we make sure that that's used up first, and then any excess would be paid for by your HSA.
Okay.
So we adjudicate every claim. The other thing that they never seem to watch is, does the spouse have a plan where she works, so that we could optimize paying part of it through your dental plan and part of it through, or maybe even the full amount, through the rest through your spousal plan, without using up your HSA. Because remember, with your HSA, you only pay for it when you use it.
Oh, right.
So if you don't use it, if you can use it, plan that you're already paying premiums for, then it's better for you and it's better for your business owner. The other thing that's involved here is the simplicity of making a claim.
Right.
Oftentimes, if it becomes cumbersome, the employee will try, and then when it gets difficult, they give it up, right? So then all of a sudden the plan is of no use. Our claim system is as simple as taking a picture of the receipt, and we do the rest.
Wow.
That's how simple it is.
That's incredible, because we do a lot of claims here in our office, and it can become a nightmare for a lot of people. And if you can take that pressure off, then people will use it a lot more, that's for sure.
The other thing that happens is each claim has a spot on it for questions about the claim. So when if your employee has a question, you might be the administrator of the plan, and they say, well, Paul, is that going to be covered? And you say, well, I haven't looked at the plan for the last 6 months, so I don't know. So there's a toll-free number that you just tell your employee, you phone them, you talk to an actual live person, and they'll walk you through the claim.
Wow.
Okay? Or you can call as the administrator and do the very same thing. So it's a toll-free number. The other thing that the HSA has to be able to do, it has to be able to add products down the road, right? Or take away products down the road, and at your discretion as the business owner. So just in recap then, and what National Health Claim does very well is that we adjudicate every claim. There's a set of eyes on every claim and a review of that claim. Secondly, it's simple. All you need to do is take a picture and we do the rest. When you have a question about the claim, you actually talk to a live person that'll walk you through it, explain it to you to your satisfaction. And then, of course, the plan is flexible. You can add on to it when you need it, things that maybe you didn't have on your plan last year. So if your HSA can do that, then you can feel comfortable going ahead because you're actually offering a real benefit to your employee.
That's really awesome. And how, as a small business owner, how hard is it to get set up with a health spending account?
Okay, very simple. Basically, what you do is you phone us on the toll-free number, and we'll assign somebody that will walk you through the setup and the claims procedure, showing you the link that you can give to every one of your employees so that they can take a picture of their receipt. They can take a picture of their receipt every day that they have a receipt. So here's some of the value proposition that we offer from National Health Claim. It's the simplest claim submission system in Canada right now. Secondly, you just take a picture and we do the rest. We reimburse claims 5 days a week.
Wow.
Monday to Friday. So you're never going to get this saying, oh, sorry, you missed the cutoff, right? If you miss today, you're going to get it tomorrow. Oftentimes, if a claim is submitted in time during the day, it's paid out before the end of the day.
Wow.
Okay? It's that simple. So our technology is state of the art.
Awesome. Now, we will have all of the links down below, the phone numbers, the contact, but more importantly, the Atlantic Business Federation sign up for the small business owners to be able to go in and fill in the form, which takes 3 minutes, 4 minutes. Then you can get set up with the health spending accounts. Then you can talk to the 1-800 number to maybe guide you through. But the links will all be down below, so check them out. So the other thing, since we're representing Atlantic Business Federation, why should people go down below and sign up? What makes Atlantic Business Federation different from...
Well, one of the big things, Paul, you negotiated with National Health Claim that there would be no admin fee or setup fee for anybody that was a member, a paid-up member of Atlantic Business Federation.
And what was that amount?
It was $300.
$300.
So that $300 is waived because they're a member of the Atlantic Business Federation.
Wow.
So what that really means is, remember, the admin fee on a claim is 10%. So if you had a $1,000 claim, remember, you're going to have to, as a business, pay $1,100 so that your employee gets that $1,000 back tax-free. You write off the full $1,100, okay? But remember, because they were a member of the Atlantic Business Federation, really, in effect, the first $3,000 worth of claims that they submit, it didn't cost you anything because you didn't pay a $300 setup fee.
So it's worthwhile for every small business, I'm going to repeat that, every small business to get registered and get set up, because fundamentally it's not going to cost you anything for those first $3,000 worth of claims. And it's so amazing what it does for the employees to know that the business that they have has their back when it comes to medical claims, and there's venues that benefit both the employee and the employer, and it's simple to do, and it doesn't take away from a health plan that you might have for your staff, but if this is the only thing that you can offer your staff, it's a fantastic start. and especially for those industries that are that it might be a challenge to get a health plan to begin with. Contractors, welders, seasonal workers, fishermen, and their first mates. It's almost impossible to get health plans. A lot of farmers. So there's a whole lot of industries that now we're opening the door to be able to take those medical claims, turn them into tax deductions, and make it more accessible for staff to get it. So we certainly encourage you to go down, set up the links, get all set up, and get your health spending accounts put in place. Harry, is there anything that you want to add to end up the show?
No, I think that just remember it's a pay-as-you-go plan.
Right.
So if you don't use it, it doesn't cost you anything, and keep your employees happy.
Yeah, for sure. It's a effective way to keep good staff in place. And like I say, you can set it up so that your key staff, your managers or your key welders or plumbers or whatever, you can set them up at different tiers for all your staff depending on what their needs are. So Mr. Demmons, we certainly appreciate you coming in as always. You know, he's just the greatest guy in the world. You never believe it. And his daughter, she's as smart as can be. So he should be very proud of very, very proud of his children, because you did a great job with them.
Thank you, Paul.
Health spending accounts, get registered, follow the links below, and we'll catch you next time. And hopefully we'll invite Harry back in a couple of months to talk about other aspects of it. So if there's any questions that you guys have, put them in the comments or in the links below, and the next time Harry's in, we can maybe answer all of those questions and get more clarity on things that people might have. So this is basically get aboard health spending accounts. Again, thank you for coming in.